Your trach oxygen mask will be here for you. Let's see what else will be here for you. Gloves you'll have to get yourself, which they'll be right here. That's it. So the rest of it, basically, the only thing that's been taken away from the picture is a stethoscope and this trach oxygen mask, okay? So all the rest of this stuff you'll be getting from the containers. We'll have all the supplies stocked in containers for you, okay? So before you come in your check off. Sound good? Okay. I'll give you, and if you want these kits today, this is a trach care, the trach suction kit. If you want these today, I've got these too. Or you can want to wait till tomorrow and just pass them out tomorrow. Because I imagine everybody's going to focus on Foley's today, right? Okay. All right, so the first thing I'm going to do is whenever we suction a patient, we're talking about suctioning trach. Does everybody know what a trach is for? What is a trach for? Breathing. Artificial airway. Okay, what might put somebody in a position that they have to have a trach? Do you guys remember?
Someone who's been ventilated for a long time.
Ventilated for a long time. Smokers, maybe they had laryngeal cancer or some kind of tumor that's caused them to have an artificial airway. If they aren't able to breathe on their own and doing intubation was a worse, because ventilation is always a more invasive option, they may do a trach instead. Okay, so that is what this is. It serves as a way for the patient to breathe, right? Okay, so if I'm coming into a room and I know I have a patient assigned to me that has a trach, I'm going to be assessing for what's the main system? Respiratory. Okay, so I'm going to come in, I'm going to listen to lung sounds, and I come in and I say, my patient sounds junky. Does anybody know what junky means? Like they have a whole bunch of stuff in their chest. It sounds yucky, right? And they're coughing and not able to cough anything up. So I am going to say, and maybe their SATs are really low, because that would be another sign and symptom that would prompt me to say, we need to clear out the airway because it's got some snot or some mucus in it that needs to be cleared out because they're not able to get good oxygen exchange, right? So I'm going to say, I'm going to suction, okay? So whenever you come into check off, you're going to do it in the same order I'm doing it here. You're going to suction, you're going to clean trach, you're going to suction, you're going to replace the cannula, and then clean the trach, okay? So suction, replace the cannula, and clean the trach. Make sense? Okay, why would we want to suction before, and I'm going to show you this just for purposes so I can kind of explain. Why would we want to suction before I take this out? Because it has mucus in it, right? I don't want to put the new one in a dirty, mucusy filled airway, right? This basically serves as a liner. It's kind of like a liner that you can take in and out. There are some that are disposable, and there are some that you have to actually clean. You'll have a sterile kit that you actually clean it in, okay? For purposes of checkoff, this is completely replaceable. We are going to take it out. We're not going to actually throw it away. This is like the J-loop. You can't throw it away, okay? And you're going to replace it with a new one, all right? So, all right, so I'm going to start with suction. Do you think suction is a sterile procedure?
Yes. Yes.
Why is it sterile? Where is that suction catheter going? So it's into the lungs, right? Yeah, so it's going straight into the lungs. So it's sterile because that catheter that's in this kit is going to go into the lungs, right? So I'm not cleaning yet. So even though I've gathered all my supplies for my checkoff, I'm going to put them all. I can put them behind me, or you can, because you only have so much room on your bedside table. Your bedside table is smaller than this, okay? I've already done my respiratory assessment. My patient has their oxygen, okay? This would normally have a tube hooked up to the wall, okay? Anytime I'm working with this, I want to go ahead and put a blue pad down whenever I'm suctioning or doing anything with cleaning. I'm just going to go ahead and put this here, okay? Now because I'm demoing, I'm not going to put this on, but for checkoffs you need to put this on. I won't make you put the goggles on because it just makes it harder to see. The masks with the shields attached are a lot nicer. But you will need to put your mask on when you're doing a checkoff, okay? Why do I wear a mask and goggles? Comes back up. Trachs can be really nasty, and if they cough when you have that cannula out, where's the only place all that stuff has to go? Right here. Yeah, okay. So you want to make sure that you're wearing a mask and goggles. Okay. Alright, so the first thing I'm going to do, this is a sterile kit, okay? This is my suction kit. Now will tell you on this side it's a 14 French catheter suction. It's a very small catheter because it's going into that airway, right? And what else? That's it. Tells you everything's in it. Every time you have a kit, when you go into a room and you get a kit for anything, always look and see what's on it. Make sure it has everything you think you're going to want while you're in there, okay? Because it always will list what's in your kit for you. Okay, so this one you have the suction tip, you have the catheter, you have vinyl gloves, a sterile wrap, and a cup. Okay, and I'm gonna take, it's my Yummy got tubing over there and turn that suction on over there. Yes, I'll take that one. Yeah. Perfect. That's good. Okay, so whenever I'm doing suction, I am going to determine one, the need for suction, like I said, through the assessment. Two, I'm going to determine if the patient is in pain, because if the patient's in pain, I want to administer them pain medications before I do the procedure. And then make sure they're comfortable. This patient is conscious, so I have them in semi-Fowler's position. If they were unconscious, I would turn them lateral facing me, okay? And that may be a question you get during a checkup. I need to know whether they're conscious or unconscious, what position would they be in, okay? All right, the next thing I'm gonna do is I have all my stuff hooked up over here. I've turned my suction on 100 to 150 for adults, okay? We'll get that question, probably, okay? And then I wanna check to make sure that my suction's working, okay? And it's working. All right, so I'm just gonna lay this here where I can get to it because I'm gonna have to hook up my suction to it. Okay. So could I open my kit like this?
Nope.
How do I open it? Away from me, right? Okay, so I'm gonna open the kit away from me. What can I touch? The outer, right? So I can touch right here, right? Okay. So the way that these kits come is your sterile cup is right here tucked in before you can even get to your sterile gloves, okay? Your sterile gloves are all wrapped up, so you can take your cup and touch it on the outside, determine the bottom from the top, you can kind of see the way the paper's done, and you're just going to touch the outside and set it right here, okay? Okay, so now I have my sterile gloves. That's the only thing that's left in here, so I can throw this away because this is all still sterile and enclosed in here, right? Okay. Now, the other thing I have to have saline to, one, wet my catheter with, and two, to flush it with, because in between suctions we want to flush out our catheter because it's likely going to have mucus in it, right? Okay. So I have my sterile saline right here. If your sterile saline has been opened, if it's for that patient, we want to always, this one hasn't been opened, we're going to do this anyway, because the ones that you guys are going to get are probably going to be open. Maybe. Goodness. It wants to stay sterile. Goodness. It's gonna come on. Oh, okay. Alright, so lay my lid upright. Lip. Okay, and then set it down. Now, I want to do everything that's non-sterile before I put on my sterile gloves. Okay, so I've pulled out my cup, I've opened my cup up. I want to pour in a little bit of sterile saline. Put it back together because I want to have what I need for my procedure. Okay, because I can't do that with sterile gloves, right? Because this is not sterile outside, right? Okay. All right, so now I'm going to go ahead and open up my gloves. You see how I'm kind of pinching the corners of the paper? Is to keep it down because it will fold back in on you if you don't do that. Okay, this paper is very conditioned to be folded for as long as it has. So kind of got to give it a little pinch on the corners. So I'm going to get my gloves. These gloves are the worst. We're sticking together. Probably not stick together. So if they stick together, you can stick your finger on the cuff portion to separate them. Okay. Let's make sure. If you want to bring an extra set of sterile gloves with you, you can. There you go. catheters in the wrong place. These screws are such a pain to work with. Okay, I'll just have to fix that in a minute. Okay, next set. Remember your thumb out. Okay, now I can go and make some adjustments here.
Am I breathing now? I can't breathe all day.
Okay, good? All right. So now everything in here is sterile. When I'm sterile, I can touch everything, right? Okay. So in here, you can pull your catheter out, drop that, just leave your paper on the table, and everything's still sterile. I'm gonna wrap my catheter. You want to manipulate the catheter with your dominant hand. So whichever dominant hand you are, and if you need to switch sides of the patient during checkoff, if you're left-handed, and that's more comfortable to you, then you can do that, okay? All right, so this is gonna become my clean hand. Sterile hand has the catheter, clean hand has the anything else that I'm gonna be touching, okay? So I'm gonna go ahead and hook up my catheter, not touching my hand to this blue part, because this is not my clean hand, it's my sterile hand, right? Connect this, and then I'm gonna check to make sure it's good, okay? Then I'm gonna wrap it back up, okay? And I can't touch the green part, because what part touched the green part? My clean hand, right? So you can't be wrapping up like this and holding on to it. You can wrap right up to the green part, okay? So wrap and hold, okay? So I'm gonna remove my oxygen from my patient, okay? Now, the other thing I wanna tell my patient before I do this is if at any point in time you feel like you're in distress, have them raise whatever hand they wanna raise. If they can raise their left hand, I would raise the hand that's farthest from you, okay? Because you don't want them hitting you. If there's ever any discomfort or they want you to stop at any point, you have them raise their left hand, okay? Or whatever hand they're able to raise, okay? So I'm gonna remove my oxygen for now, and I'm gonna go ahead and wet the tip of my catheter, just to lubricate it a little bit, okay? Now, when I pass down into the trachea, okay, I'm gonna go about 5 or 6 inches, 4 to 6 inches, okay? Alright, and then how long can I stay down? Does anybody know?
Less than 30 seconds.
Less than 30 seconds. 30 seconds to a minute max. Okay, less than 30 seconds is what you want though. Actually probably 15 to 20 seconds. How long between suctions do I wait? That's a 30 to a minute, 30 seconds to a minute. Because between suctions we want to re-oxygenate, right? The other thing is, how many times can I pass? Anybody know? 2. It is 2. Okay, up to 2 times. Okay? Alright, so when I suction, you want to pay attention to where your catheter is, because if you get and you're too focused on your trach, look what happens with my catheter. Where's my catheter? It's touching this, right? It's no longer sterile, okay? So it's another part of the procedure where you want to be dramatic. Remember how Crystal talked about being dramatic? Okay. So I'm not going to cover my suction up until I get down in there and coming back out, okay? So I'm going to go down into the trach. What is your patient not able to do when this is in there? Breathe. Exactly, okay? So as I come out, I'm going to do intermittent suction like this, okay? And I'm going to twist and move my hand down to manage my catheter as it comes out. So twisting back and forth. Everybody see that? So twisting like this as I come out and back and forth. Up and down, okay? So then I come over here. I wrap my catheter back up because this hand's still sterile, right? Give my patient back their oxygen. And then come over here and clean out my catheter, okay? I've waited a minute. I'm gonna come back. I'm gonna pass again. I'll remove the oxygen with my clean hand. Open up my catheter. Let my patient know we're gonna do this again. So down. And twisting. And you see how my hand moves down every time I pull the catheter out? Does that make sense to everybody? Whenever I say that. So if I have my catheter in here My hand moves back as it goes in and moves closer as it comes out. So as it comes out, I'm bringing my hand back down close to the trach because it maintains my control of sterility of that tubing. Does that make sense, everybody? Okay. Because if I'm going like this and I touch the catheter, the trach, is my hand sterile anymore? It's not. So as you go in, you move back. As you pull out, you move towards it without touching it. Does that make sense? Then wrap it back up. Good? So we're done. I'm hyper-oxygenating my patient again. I'm giving him back the oxygen. Your steps, we'll talk about the ambu bag. We're not doing that. But that is an option to hook up an ambu bag and give manual hyperventilation to increase oxygen exchange and kind of give them a breath and then replace their oxygen so that they're better prepared to do this again. Go by your facility's policy. For checkoffs, we're just going to use the trach collar, the trach oxygenation mask. Okay. When you're done with this, it stays in this glove. Okay. You close it up in your glove. Okay. And then throw it away. That's suction. Okay. Everybody good with that? Questions? No?